The renal arteries, we saw them, they are branches of the abdominal aorta at the level lumbar vertebra 1. Now I want you to look at this critically. This is our right kidney, and this is our left kidney. The right kidney is slightly lower because of the big right lobe of the liver, meaning that the right renal artery is given off at a slightly lower level than the left renal artery. Because, because of the big right lobe of the liver, it kind of presses the right kidney to descend slightly lower than the left kidney. That is why the right renal artery is given off at a slightly lower level than the left renal artery. But both of them are branches of the abdominal aorta at level approximately L1. What are we seeing? We are seeing this inferior vena cava on the right and the aorta on the left. When the right renal artery is given off, it passes posterior to the IVC and then it goes to enter the right kidney. So on its way to the right kidney, the right renal artery passes posterior to the inferior vena cava, and that makes it longer than the left. It passes posterior to the inferior vena cava and also posterior to the right renal vein, and then it will enter the hilum of the right kidney. Whereas the left renal artery is given off at a slightly higher level than the right renal artery, but for it, it passes only posterior to the left renal vein. So the left renal artery, number one, is given off at a slightly higher level because the left kidney is higher than the right kidney. Number two, it is shorter than the right renal artery. Number three, it only passes posterior to the left renal vein and enters the left kidney. So this left renal artery, given off at a slightly higher level, it is shorter, it only passes posterior to the left renal vein. Right renal artery, given off at a slightly lower level, it is longer, it passes posterior to both the IVC and the right renal vein. Then the renal veins. The renal veins will have the right renal vein and the left renal vein. The right renal vein drains into the inferior vena cava, still at a level slightly lower than the left renal vein because of the position of the right kidney. It is shorter than the left renal vein. On the other hand, the left renal vein moves anterior to the left renal artery. It passes posterior to the superior mesenteric artery and then joins the inferior vena cava at a slightly higher level than that of the right renal vein. So in this position, the left renal vein is passing anterior. The left renal vein is passing posterior, not anterior. So at this position, the left renal vein is passing posterior to the superior mesenteric vein and anterior to the abdominal aorta. Are you seeing that? The left renal vein is passing posterior to the superior mesenteric vein and anterior to the aorta. Are you seeing that?
Yes.
Therefore, it is in between the aorta posteriorly and the superior mesenteric vein anterior. It is sandwiched in between those. And this is what we call the pincer effect, compression of the left renal vein as it is passing between the aorta posteriorly and the superior vena cava anteriorly. And this happens only to the left renal vein. So these gross differences must be appreciated, much as we know that the renal veins drain and supply the kidneys. Now, what other branches are given off by the renal arteries? What other branches are given off by the renal arteries? What other branches are given off by the renal arteries? Because I said that renal arteries not only supply they not only supply the kidneys, but they also supply the structures. Now, the renal artery gives off a branch to the suprarenal gland, that is the suprarenal artery, and then a branch to the upper aspect of the aorta, and then it will enter the hilum of the kidneys. So in this way, it supplies the suprarenal gland, the upper portion of the aorta, and then it will enter to supply the kidneys. So we not only talk about it as a supply to the kidneys, but it gives off a branch to the suprarenal gland, a branch to the ureters, and then it will enter the hilum of the kidneys on both sides. Whereas the renal veins, the left renal vein receives blood from the suprarenal gland and the left gonadal artery, but the right renal vein only receives blood from the suprarenal gland. So the tributaries of the left renal vein will have the suprarenal vein, and then the gonadal vein, and then some veins coming from the upper part of the ureters. Whereas on the right, we have the tributaries from the suprarenal glands and then from the ureters, because the right renal vein does not receive the gonadal artery. The gonadal artery on the right drains into the IVC. So it is very, very important for us to appreciate the blood supply of the kidneys and its venous drainage in detail, other than saying renal artery and renal vein and ending there. And I may ask the differences between the right renal vein and the left renal vein, the differences between the right renal artery and the left renal artery. Talk about the branches, the tributaries, the structure, its course, its relations, so that you appreciate it.